We're four guys from Holland, from different companies and different aspects of the healthcare ICT, and we're all part of the work group of patient care coordination. And we all have a shared interest, and that is we're interested in what is going on in the IHE, we're interested in oncology, and we're interested in getting results. So we want practical solutions to work with these new standards that we're working on. Okay. So this is first of all a slide that I wanted to show you. Do you know what this is? Do you have any idea? Is it, are they having a lottery for a new iPad for Christmas? Or so what do you think this can be? A lot of people in white clothes. Does anybody have an idea? Exactly. So this is a Tumor Board meeting, but this is one of the first Tumor Board meetings. And as you can see, there's a lot of chaos here, a lot of people. The reason is that the first Tumor Board meetings that we were holding in Holland were generic Tumor Board meetings. So everything and anything oncological was being dealt here in these Tumor Board meetings. And as you can see, there are a lot of different people who like a pathologist, an oncologist, and a radiologist, and radiotherapists, and internal medicine doctors, and they also have their colleagues, etc. And they all come together for these Tumor Board meetings. That is one of the reasons why in Holland at the moment we don't have any more those generic Tumor Board meetings. We have Tumor Board meetings which are specialized for a certain case, like colon cancer or lung cancer or mamma carcinoma or things like that. And for each type of cancer we have a specialized Tumor Board meetings. What you see here, it's not very clear, but is a Tumor Board meeting which is held in an academic hospital. Sorry. On the left-hand side you see the hospital information system of the academic hospital, and on the right-hand side through VPN you can see the information system of another hospital which is 25 kilometers away. And these Tumor Board meetings are held with a little bit of video conferencing that you see in the bottom over there. Have the next slide, please. Okay, so why do we have these Tumor Board meetings? Well, I've summed it up a little bit. About 70% of the budget and the time that people are spending in the healthcare is for chronic healthcare. That means oncological, cardiological, endocrinological, and lung problems are the main problems, and they take up most of the cost and the time of the healthcare in Holland. So most of these cases are multidisciplinary in nature because of the chronic nature and of the different specialties that are necessary to have a good therapy for these patients. And in a growing number, they are also cross-enterprise because in Holland there's a tendency for specialization of Tumor Board treatments. Some tumor types are being dealt with or being operated on in this hospital. Other types of cancer are being treated in another hospital. That leads to an adhesion or affluence of different patients from one hospital to another, and in that case you need to have cross-enterprise communication. Okay. In Holland we have about 100 hospitals, which are academic centers, and each hospital in Holland organizes roughly between 5 and 15 Tumor Board meetings each week. So 10 to 15 or 5 to 15 meetings are held. They last for about 1 hour, and you have about 4 minutes for each patient. Okay, there's a lot of discussion going on, and people talk to each other and they discuss about the patient. In the early stages, it was that there were only very difficult cases. Currently, it's more like if you have a certain type of cancer, you always go to this Tumor Board meeting, and this Tumor Board meeting gets you could say, smarter and smarter, and there's a continuous education of the people who are in these meetings, because they know of the newest developments from the super specialist or from somebody who has done some extra research, because now you have real focus on this kind of tumor. You get more quality of the therapy. Actually, there was one little research which showed that if a doctor has a certain therapy in mind and he goes to this tumor board meeting, in about 50% of the times, the final treatment is different from what he thought it should be. So there's a lot of change going on in that direction. Okay, even nog terug. Yeah. Okay, so what are the goals for these tumor board meetings? Why are they held in Holland so often? And as I've heard, it's not going on very often here. Is that correct? Yeah, okay. Well, we want, of course, a high quality treatment. So that also means that there are less exacerbations, less complications. So in the end, a higher quality care is also a cheaper care. And that is, for the Dutch, always very important. We also want to have a more effective throughput. We want to have the patients being dealt with in a faster way, and more efficient way, and in a controlled way, so that we know that we've checked everything necessary to have the best therapy for these patients. And as I also mentioned, because these meetings are held every week, the latest developments are shared between the different specialists. Can I have the next, please? So, these tumor board meetings, they all have roughly the same throughput. They have the same steps that are being taken. And I've written them down here, and there are 5 steps, and that's it. And that also means that this is a nice candidate for an XDW profile. Okay. First of all, we have a request for a tumor board review, which comes from an oncologist or an internist or a surgeon, and he asks the tumor board, can we discuss this patient? With it, he ships medical information, he ships the request information, so he wants to have a specific question answered, and he sends the necessary images. So that is, for instance, a CT scan, or it can also be a result from a pathologist, and this combination of information is used by the board to make their conclusions and to do what's an advies? Proposition for treatment. That is what I was looking for. Yeah. Okay. So first of all, he requests. So the requester requests the tumor board review. Then there's a chairman who has to schedule the tumor board review, and it's not just scheduling. It's also he checks the inclusion and exclusion criteria for this tumor board. So if it's a tumor not exactly in the scope of this tumor board review, he can be rejected. In most of the cases, are well aware of the type of tumor board review. So, but there is a possibility that some patients will be put aside. Okay, so that's the chairman who decides which patients are going to be held on the next meeting. Okay. Then it takes about 3 or 4 days before the actual meeting, and in this period the information can be used by colleagues. In the current situation, if you have 2 hospitals, you have a DVD which is being sent from one hospital to the other hospital, and you have a fax or an email with the request information, the textual information. That means that only 2 people. Oh, that means that only 2 people can actually watch the images, and there are very few people who have all the information at hand, and that is something that we would like to have improved in this stage, because in this stage you can also have discussions with your colleagues before the actual tumor board meeting, and there are also some cases where people have said, well, I think this is something, it's a clear case for operation, and then at the actual tumor board meeting, this patient can only take 1 minute, and so they have more time for another patient, which is more complicated. So this can be pre-processed already. Then we have the next stage, which is the tumor board meeting itself. And in this stage, everybody's, they go through the different patients, they discuss the patients, and there's a nodulist, a type, but he's also a doctor, so he or she knows what is written down. Is writing down the conclusion and the proposed therapy. Okay. Last stage is a stage where the chairman for each patient validates the conclusion and the proposed therapy, and then there's a report or a document is being sent to the requestor and or to the GP or other physicians that are part of this care pathway. So those are the different stages. If you look at the possibilities that are there for XDW, those stages are, those are all the steps or tasks for this process, and this is something that you can describe in XDW, where you have on each stage an input document and one or more output documents. Some of the output documents are used as input for the next step, so you have also a chronological task which follows one after the other. De volgende? Okay, we'll take you very quickly to a prototype that we're building at this moment for discussion purposes, and we're going to build it in, well, the next year. This is, we take those different steps. This is the first step where a physician requests a new tumor board review. He just says, okay, I'm Dr. Haig. I want to have the esophagus carcinoma MDO because there are different types of tumor board reviews. And the urgency is that I want to have it in a regular planning. And he says, okay, and he clicks on new MDO. And then there is some data which is automatically added to this website that is coming from the hospital information system. On the right-hand side, you see relevant medical history. That's, those are diagnoses. Those are all diagnostic studies. And the medication is automatically imported. And on the left-hand side, the green one, the bespreking. That piece of text is the actual request of the oncologist or the person who wants to have the patient in the discussion. In the preparation phase, everybody can watch, can see this information. He can see on the different patients, he can walk through the patients, he can see the question of the requestor, and if he likes, he can also add text. So there are 2 texts, but you can have 3 or 4 or 5 texts, and everybody can read the texts, and it can be questions or conclusions or discussions. Those are free, sort of chat-like possibilities. Of course, you can also click on the XMAMA, and then you can see, can you click on the next one? Then you can actually see the images as well, with the report that is connected to this diagnostic study. So they are linked. So he knows everything that is to know about the patients is in this website. He can look at the PA, the pathology report, and he can look at anything that is necessary and described in this XDW profile for this type of tumor board review. Okay. Volgende. Ja, oké. Nou, dat hoeft niet. Dan gaan we door. Okay. The stage that I have not written, have not shown here, is the phase where after the tumor board review, the conclusion is becoming part of a larger document with automatically added all the information that you saw, and also who has been attending the tumor board review. That's all automatically sent to the requester and the GP. So for this to work, and you need a lot of information being exchanged between the different hospitals. You need, in technical terms, a shared workflow. So you need to know, why is this process going on? You have to have a definition of the content. So what do you put in the documents? That is the what. And you need an infrastructure, you could say the warehouses and the roads between it, and that is the XDS, and that is the how. Do you transport information from one hospital to another so that everybody can have a look at what is necessary to see? Ja, nog eentje? Okay. Positioning. The XDW profile is an implementation profile within the ITI domain. So it's a generic tool, whereas the XDBWD profile, which means cross-enterprise tumor board meeting workflow definition profile, that is a content profile within the PCC domain, which of course is very logical. It takes a bit of thinking about it, but that is the idea. The PCC domain is where you have these actual tumor board meetings, the actual processes, and it uses XDW for the logistical part. Okay, so with the last couple of days we've been working out this profile. As you can see, it's hard work. Ik neem de volgende. And currently we're writing the document, and we hope to have the first proposal of the XDW tumor board definition profile ready in a short while. As you can see, we're working on it. And, well, what we hope is that when we use XDW profile in the PCC context, that this kind of chaos will vanish, and it will have very nice and efficient workflow tumor board meetings. Thanks so much.